More than 800 Oklahomans died last year from the same cause. It wasn't Ebola, bird flu, or West Nile virus, but it has reached epidemic proportions. More than 800 Oklahomans died last year from prescription drug overdoses. The National Centers for Disease Control and Prevention have recognized Oklahoma's staggering overdose death rate by awarding a grant to tackle the critical issue. And so far, the money spent is paying off.
Oklahoma ranks 4th in the nation in prescription painkiller consumption.
For every 100 citizens in Oklahoma, there are 128 prescriptions of prescription painkillers written every year.
Commissioner of the Oklahoma Department of Mental Health and Substance Abuse Services, Terry White, repeats the startling statistics to communities across Oklahoma in hopes it will move some to action. She recently took her message to a summit in Tulsa led by Mayor Dewey Bartlett. Doctors, educators, and community leaders were shocked by some of what was learned there.
In fact, when you look at our counties, Tulsa County has the highest overdose rate in Oklahoma.
While often a mayor's job is to be a champion for city accomplishments, Bartlett sees the crisis as something everyone should know about.
Because we were, as far as prescription drug deaths and overdosing went, we were the worst in the state, far and away, and we were the 18th worst of all counties in the country. 18 out of well over 3,000 counties in the United States of America.
Using grant money from the Centers for Disease Control, Tulsa's first responders and the state formed a partnership to launch a pilot program.
Since the pilot began in April, Tulsa County has already saved 11 lives. 11 Tulsans we would have lost to overdose death have been saved.
The lifesaver is called Narcan or naloxone. It is a prescription that first responders can spray up the nostrils of a person suspected of taking too many painkillers.
What naloxone does is it forces their respiratory system to breathe until they can get to a hospital, and it saves lives.
Tulsa County Sheriff's Deputy David Allen responded to an emergency call regarding a suspected drug overdose earlier this year.
And I came into the bathroom and saw her. She was laying naked on the ground, face up, and for all intents and purposes, she appeared to be dead.
Deputy Allen had his emergency kit containing Narcan with him, and his training on its use kicked in within 30 seconds of assessing the woman.
And as I administered it, almost immediately after I'd completed the administration, she breathed in real deep, like started to sit up, started to roll over.
Allen says the woman started vocalizing and moving.
It was amazing because it was like watching a dead person, wake up from a coma.
Narcan wears off quickly, but it worked long enough to get the woman to a hospital where she recovered.
I think for me, naloxone is synonymous with second chance, because I think, if Austin could have just had a second chance, we could have addressed whatever was going on and maybe made a difference.
Gail Box and her family are approaching their 4th Christmas without Austin.
Hello, I'm Gail Box. My son Austin Box died tragically in 2011 from a prescription drug overdose.
Austin Box, number 12 for the Oklahoma Sooners, died of an overdose in May of 2011. Gail is spending much of her time spreading the word of her son and their family tragedy to educate others.
Austin graduated from college on that Saturday, and that was the last time that I saw him.
Gail says Austin and his father left town to attend a Cardinals game the Sunday after graduation. They returned on Wednesday. Gail says the two had a great time and that her husband didn't notice anything wrong with their son. Austin took his longtime girlfriend to the airport and then headed to see a former high school coach and his son in El Reno. Thursday morning, Gail got a call at the Enid school where she worked as a counselor.
I got a call that Austin was in the emergency room, and the person that called me just said, "All I can tell you is he's breathing right now."
Gail believes Austin might have started taking opiates after he was hospitalized for a ruptured disc in his back while playing a scrimmage 7 months before his death. But the drugs found in Austin during an autopsy were not prescribed to him. The report noted the presence of oxymorphone, morphine, hydrocodone, hydromorphone, oxycodone, and the anti-anxiety drug Xanax. Gail doesn't know where he got the drugs or exactly how long he had been taking them.
Austin Box.
The OU Athletic Department produced a video tribute to Austin showing how people remember him. Gail says Austin's teammates, his girlfriend, and close friends had no idea of his drug use. White says opiate addiction can make people you know and love do desperate things in secret.
Lots of us have holiday parties around this time of year. You'd be amazed at how many people are struggling with the issue of prescription painkiller addiction and will go through other people's medicine cabinets.
There is a statewide effort encouraging Oklahomans to discard their leftover painkillers safely. Doctors are also being urged to curb the number of prescriptions they write by checking the statewide drug registry. In real time, it shows who is being prescribed what and by which doctors. And Tulsa's success with the use of Narcan is now spreading to surrounding communities and will soon be adopted by Oklahoma City first responders. Gail urges others to remember her beautiful son in hopes they can be spared gut-wrenching grief.
I don't know if there were indicators that I overlooked. I have racked my brain. You know, I will always live with guilt.
Tears roll down my face.